Thank you so much for joining me here at the live desk. Right now, we are going beyond the headlines as we talk about healthcare today, an important topic after a study was just released earlier this morning. So I do want to take a look at this video. Women in a 2023 survey reported negative healthcare experiences during pregnancy and delivery. That's according to a new CDC vital signs report. Now, with recent maternal deaths increasing here in the U.S., improving the quality of maternity care and ensuring open provider-patient communication are critical to detect potentially life-threatening pregnancy complications and ensure healthy mothers and babies. Now, with all of that being said, I do want to bring in Dr. Mark Parrish. He is an OBGYN at the University of Kansas Health System, I should say. Dr. Mark Parrish, I want to thank you so much for joining me today. And I do just want to start off with an important question. You know, mistreatment during maternity care is higher among Black, Hispanic, and multiracial women. We saw that in the study that was released earlier today. I want to ask you, why do you think that is?
Now that is a question that I think gets deep into a level of trust that patients of different ethnicities have with the health systems. Going back decades, if not even more than decades, there has been systemic racism that is present in healthcare systems, and that's been well documented in other studies that would corroborate what this study is showing. But when you start to get that level of mistrust that's built between the patient and the physician, that relationship is automatically fractured. And so a lot of times communication between the physician and the patient are not as good as they should be. And when you have that lack of trust, lack of communication, then you start to have adverse outcomes occurring because of that poor communication that's present.
Yeah, and unfortunately, I do want to take a look at this video again, but unfortunately, this is a topic that we are seeing more often here lately. And I do want to touch on that study once again, coming from the CDC. They said that the most common types of mistreatments were reported were receiving no response to requests for help, being shouted at, or scolded, not having their physical privacy protected, and being threatened with withholding treatment or made to accept unwanted treatment. Now, you all play a critical role in eliminating preventable maternal mortality. How are you all trying to combat that issue as a local health system here?
Absolutely. I think that, it's a simple golden rule thing. Treat people like you want to be treated. And we all do that. The study that you're referring to is and some of the, specific situations that were brought about from patient experiences is shocking and atrocious, but we know that they occur. Fortunately, at the University of Kansas Health System, that is certainly not acceptable, and none of us, at least, in our health system or in my specific little world that I live in, would ever allow anything like that to occur. It is vital that we have good communication with patients and truly treat them as we would want to be treated ourselves. And if you don't have that good communication with your patients, you're not listening, you're not only losing the patient's trust in you, and so they're not going to necessarily divulge information that may be important to their care, but it's simple human knowledge here that if you're not listening to people, that there are a lot of things that you can miss. And so it can be, it's definitely on the physician to be listening, but if there is that perception from the patient that the physician is not listening, you lose that trust. They stop divulging information to you that could be critical to their healthcare outcomes.
And Dr. Parrish, if you don't mind me asking, how long have you been in the healthcare profession as an OBGYN?
As an OBGYN since 2007, so 16 years, as a maternal fetal medicine specialist since 2010.
Okay, and so how
for
does
13 years.
a long time, right? And so I
Mm-hmm.
just want you to touch a little bit more on how this makes you feel to see, that these reports are still coming out, like I
Yeah.
said, more often here lately. But as far as the mistreatment and then the maternal mortality, it continues to rise day by day. So speak a little bit more about
Mm-hmm.
that based off of the years that you have been in this profession.
Yeah. I think it's number one, it's recognizing that was a problem until it's shocking probably to a lot of folks out there, but in the last 20 years, 15 to 20 years, this information that we have, specifically again in my world about pregnancy outcomes, wasn't well studied. A better way to put it is we were not capturing the information like we should. So we didn't know that the outcomes that were occurring were actually occurring because we just didn't have the data. Once you start to get this data, then you need to start taking deeper dives, and that's what the health systems have been trying to do. We do this not only at a national level, but we do it within our own health system here. For instance, we dedicate specific committees to quality improvement in patient safety outcomes at the health system level, all the way down to the department and division levels, and for us, even at the level of labor and delivery. And you start taking that information that's gained and you say, okay, well, why are these outcomes occurring? Is there something occurring that's due to communication? Is it a medical knowledge deficit? Is it a systemic issue? And you're able to break that down. And literally, if you're talking about just 20 years, that's really not that long ago. And so we're still arguably in the toddler years of our understanding of not only what type of adverse health outcomes that we're seeing, and they can be specific to different regions of the United States. What we see here in Kansas City may be different than what they're seeing on the West Coast or on the East Coast, for instance. But ultimately, first, the most important thing is recognizing there's a problem, and then secondly, being able to diagnose what is leading to the problem that you're observing.
Definitely recognizing that there is a problem, and I think that this is a conversation that needs to be had. So again, Dr. Parrish, I appreciate you taking the time to sit down and have this conversation with us. Now, as far as our viewers, we will have more statistics coming up during our 4 p.m. and later newscast, so be sure to tune in to that. And if you just happen to tune in to this conversation a little bit late, we will have it posted on our website a little bit later. But thank you again, Dr. Parrish, for joining me here at the Live Desk.
Thank you.